All right, so today I'm going to demonstrate part of a cervical spine exam. So first we're going to start with palpations. So we're going to come and we'll just palpate in the front, and you'll have your sternum right in the middle here. And then you'll go up and you'll get to your clavicle. And then in the front, you'll also have your sternocleidomastoid muscle that'll go all the way up to your neck. If my patient can turn your head to the side, it'll pop out right about here. And then you'll have your, you can turn back and face me, you'll have your hyoid bone that's going to be up here. And then down here you'll have your hyoid cartilage and your cricoid cartilage. Then if we go to the back, you will have your cervical spine. So up at the top, you'll have your spinous process, which will start your cervical spine, and you'll have 7 of them. So you'll start with your C1, which is right below your occipital bones, which are going to be up here. And so you'll have your C1 and C2, which are not very palpable. And then 3, 4, 5, 6, and 7. And 7 will end the cervical spine vertebrae. And then if you come over here, you'll have the start of your scapula, and then you'll have the upper traps right and along here. Next, I'm going to do active range of motion with my patient. So I'm just going to have her do cervical flexion. So look down to the ground, just like this. Good. And extension. So you're going to look back up at me and then go back as far as you can. Good. And then you can look back at me again. Next, you'll do lateral bending. So if you'll look over to one of your shoulders like this, and the other shoulder, good. And the last one will be rotation. So if you will, you're going to look down, and then you're just going to look over this way again, and then down here and over here. And then another way for you to do rotation is just if you do like this, lean to one side and up, and then lean to the other side. Good. Next, we're going to do 3 special tests with my patient. So we're going to have her lie down on her back. We're going to have her neck a little bit over the edge of the sofa. Yes, just like that. And I'll just hold her head in my hands. And so the first thing we're going to do is the vertebral artery test. So this is going to check for any occlusion of the vertebral artery. So I will just hold my patient right here, right at her occipital bones, and I will turn her head one direction and hold it there for about 30 seconds and ask my patient if she feels nauseous or dizzy or anything. No? No? All right, good. And do the same with the other side. And a positive for this is if they do feel nauseous. The second test we're going to do is the Sperling's test. So that one, I'm just going to have my patient have her head in my hands here, and we're going to do the cervical distraction test. So I'll put my hand right here at the occipital bone and on her forehead, and I'm just going to pull out along her cervical bone. And so that is going to reduce any symptoms or pain if she does have any spinal compression. And then the last one is going to be the Sperling's test. So, okay, you can cut this one now.